Hi everyone, welcome to the Afya Health and Lifestyle interview series from the Agbari Multimedia company, where we invite well-seasoned health specialists to educate you on medical conditions, shed light on some of the misconceptions you must have heard about them, and equip you with practical tips to attaining good health. If you have any questions for our guests, feel free to drop them in the comment sections, and we'll be sure to respond to every one of them. If you're watching us for the first time, welcome to the Agbari channel, and please don't forget to subscribe, like, and share. And if you're a returning subscriber, it's great to have you here again. Remember to drop your comments and hit the post notifications button so you don't miss out on our next post. So the topic for today is health screening and medical checkups, a luxury or a necessity for all. And we have brought just the exceptional guest for that in the person of Dr. Molade. Dr. Molade Ogun is a board certified family physician in California, born and raised in Lagos, Nigeria. She gained her MBBS degree in the University of Lagos in 2000, after which she proceeded to complete a residency training at USC Family Medicine Residency Training Program. She is board certified in Family and Obesity Medicine and also a fellow American Academy of Family Physicians. Dr. Molade is passionate about women's health and preventive medicine and enjoys spending time with family, meditating, traveling, and swimming. Nice to, it's nice to have you on the show, Ma.
Oh, thanks for having me.
Yes, hi. Good morning, Ma. Trust your day is going well.
Yes, so far so good. Can't complain.
Okay, that's great to hear. So, thank you for gracing us with your presence. And so, would you like to say hi to our viewers?
Hello, everyone. I hope you find this episode educative and it helps you with your decision making about your health.
Okay, okay, thank you very much for that short, but straight to the point. So, I feel like I must ask, having gone through your bio, I see you're one of those people that somehow found balance between your work life and your personal life. You don't let one suffer the other. When I saw your hobbies, I'm like, how do you practice medicine and still have time to do all of those things? So I'm just curious as to how you do it, how you pull it off.
Thanks for that question. I honestly don't know how I juggle all these things. First, I'd like to thank God for the for the gift of life and his lessons along the way. And I would attribute my ability to juggle all those things to the training I got from my parents while growing up. And what I basically do is I focus on what is important. And I prioritize, I plan, and I also listen to uh, my body in terms of how do I feel. When I'm tired, I try to rest because I know that nobody's indispensable. And I also have hobbies that help me relax, such as meditation, praying, talking with friends and family, and also taking walks here and there just to maintain a sense of balance because it's hectic being a mom, being a wife, and being a doctor.
Oh, there's like four things all at once. Okay, thank you for the tips. I feel like there's some things I'm going to make use of as well. So let's get straight to it. I would like us to start with the basics. So the topic for today is health screening and medical checkups, a luxury or a necessity. In this context, what exactly does health screening and medical checkups refer to? Is it like going to a health professional when one feels sick or just testing for certain diseases whenever the opportunity arises, like when you're having free screenings? Or is there more to it than those?
Um, I would say that is always trying to strike a balance between being sick and being well. And
Okay.
health screening is one of the major ways of picking up potential diseases early. And in most cases, when patients have these diseases, they might not even have any complaints or few complaints. But when one is screened regularly, the diseases are picked up, and when they're picked up, um, there's a potential for prevention or progression of the disease, and also early treatment that could prevent complications and untimely death.
Okay.
So going back to your question, which is it like a random thing? In most cases, health screenings are not random. They are usually age specific, and also they depend on the risk factors of the patients themselves.
Okay. So I'm picking on that statement. So different age groups and risk factors, and people predisposed to other risk factors would have different or varying frequencies to the health screening.
Exactly. A typical example is colon cancer screening. In most cases, we
Okay.
recommend that people get screened for colon cancer after age 45. But in a situation where a family member is a family member, which we describe as a first degree family member, which is either a brother or a sister, is diagnosed with colon cancer early, like at the age of 35. In a situation like that, we recommend that the siblings get checked 10 years before the age of diagnosis of the person that had colon cancer. So in this situation where a family member is diagnosed at age 35, anybody in that family that is older than 25 should get checked should start colon cancer screening um, at that age. Any sibling that is older than 25 should start colon cancer screening and not wait until they're 45 like the general population will.
Okay. Okay. So it's different strokes for different folks.
What did you say?
I said so like a situation of different strokes for different folks.
Exactly, exactly.
Okay. Thank you very much for that. So moving forward, many people are of the opinion if I feel fine or if they feel fine, why should they go for medical checkups and pay money for these checkups if they feel fine? How do you overcome this resistance to spending when the person feels fine?
Okay. A good
Yes.
way to address that is that prevention is always better than cure. And when diseases are diagnosed early, there is the potential of preventing financial, um, emotional, and psychosocial um, complications associated with the disease. A typical example is when a woman undergoes some pap smear for cervical cancer detection. At times, we're able to pick up precancerous lesions that could be easily treated with surveillance or um, procedures like cryosurgery, where the lesion is frozen versus the woman dying from it. So, um, going back to your question, prevention is always better than cure. So let's try to develop a culture where we do our screenings regularly in order to prevent us from getting really sick from diseases that could be easily treated when detected early.
Okay. Okay. Thank you very much for that. I feel like following up on what you said. I feel like so in the long run, while you're trying to save money, actually going for these screenings early is more economical than waiting until they progress. So
Exactly,
that's
exactly. Because at times people feel, oh my goodness, why should I go for the screening if I have to leave my job to schedule an appointment? But the reality is, if you get really sick, you might have to quit that job because you're not able to leave the hospital.
true. So it's better for you to take out the time and money while you can,
Exactly.
comfortable, than wait for the emergency situations to come.
Hmm.
Okay. So the next question will be, based on your years of experience in the field, you graduated since like 2000, so you've been practicing for over 20 years. That's correct. Based on your years of experience in the field, what would you say the most recurring hindrances to individuals intentionally seeking regular health screening is? What have you found that stops most people from coming to the hospitals to just check for themselves or to get themselves checked?
There's so many things that could prevent patients from getting their regular screenings. One is at times patients don't even know they're supposed to be screened. So they don't know they are supposed to be screened. Then the other thing is you have a situation where there is a mistrust of the medical system, and there's also inability to leave their job or other responsibilities in order to take care of the appointments for screenings. Then the other thing we need to figure out is, or rather, the other thing we need to deal with is a situation where when they know, are there facilities or structures in place that would encourage health screening? Do we have community clinics that the patients can visit? Do Especially in situations where resources are so limited, especially in developing countries where the structure is not just there. Then the other issue we have to deal with is um, when the structure is there and the person is willing, what if they do not have the insurance that could cover or pay for such services? So there's so many things that come into play when when it comes to screening. Um, Person dependent, people system dependent, and also um, finances and the social support system too.
Okay, thank you very much for that. So moving on, next question will be, having established this and the hindrances, what initiatives or schemes do you think can be taken towards fostering this culture in people of fostering this culture where people are more intentional about their health when they go to the hospitals to get regular checks without falling sick, without being told? It just becomes, what do you think? What initiatives can be put into place so people are more aware and intentional about their health?
What I would like to say is systems like what we have right now, what your organization is doing to improve awareness is a great way to start. Where we have platforms like yours, where people get the opportunity to um, ask questions or get information that they need on what needs to be done. Um, and then the other thing we need to um, give people would be resources like my health finder tool on the internet, where people can just punch in their information and it will tell them what type of screenings um, they need based off their age, based off their gender, and then so that when they're seeing their doctors or healthcare professionals, they'll be able to ask appropriate questions in terms of screening. So, in summary, it's awareness, because when people are aware, they would most likely um, seek care.
Okay. Okay. Thank you very much for that. And so, in summary, once we raise the awareness, people are more inclined to develop this, to cultivate this health seeking habits.
Exactly. Yes, I would want to share my screen, which shows basically the recommended general recommendations in terms of health screening for the population. All adults who are obese or overweight, we recommend that they should have the diabetic screening done, and also people should have their annual depression screening done. Colorectal cancer should be colorectal cancer screening should be started at age 45 to 75. And like we mentioned earlier, when the risk factors exist, it can be done sooner. High blood pressure screening should also be done on a regular basis, because when the blood pressure is elevated, people are at risk for having end organ damage, such as stroke, such as kidney damage and all that, kidney damage. But in a situation where the diagnosis is made early, it may be it may be treated with lifestyle modification, which includes regular exercises, cutting down on salt intake, and cutting down on stress, and so many other modalities that um, enhance health. Um, we also recommend STD screening to be done in sexually active adults and adolescents, um, so that sexually transmitted diseases can be picked up early and treated accordingly. HIV screening, and there are also, as mentioned on the screen, there are screenings done for lung cancer in patients that are at risk for it. Um, in men specifically, we recommend that there should be a one-time screening for men between age 65 to 75 if they've ever smoked. So for men aged 65 to 75, if they've ever smoked, we recommend an ultrasound to check for abdominal aortic aneurysm. And for women, we recommend that cervical cancer screening should be done every 3 years with cervical cytology, or from age 21 to 29, and from age 30 to 65, they should have their test done every 3 to 5 years, depending on if the cytology was done alone or cytology with HPV DNA. Breast cancer screening should be done from age 50 to 75. However, there is a recommendation. Uh, um, However, in African Americans and as well as Africans, it is recommended that it should be done starting at age 40, because um, the type of cancer that Africans have is very aggressive. So if we have to wait until age 50, it might be too late to start annual um, annual screenings. We also recommend the BRCA testing for people with a family history of breast, ovarian, tubal, or peritoneal cancers, and also osteoporosis screening for women over age 65 or people that has risk for osteoporosis.
Okay, that's very comprehensive. Oh,
So in summary, what we tried to talk about today is that screening picks up diseases early,
okay,
and it's not in all cases that we need medications. At times, it might just be lifestyle modification, especially in patients with high blood pressure, hyperlipidemia, um, lifestyle modification in terms of regular exercises, healthy diet, and not quitting smoking, and making sure that one is able to rest adequately might just be what is necessary to prevent diseases such as um, strokes, such as kidney disease, that are complications of high blood pressure. Um, and at other times, in cases like diabetes mellitus type 2, when this when diabetes mellitus is picked up early, one is able to prevent complications, and
okay,
it can be managed with medications and appropriate lifestyle changes, and there won't be complicate the and that reduces the risk of complications like blindness, like
okay,
amputation of the limbs, and because hospitalizations, strokes, kidney disease, and um, other complications that might be associated with um, diabetes mellitus. So, in summary, we need to encourage ourselves to make sure that we do our screenings in a regular fashion. Some people um, schedule their appointments during the month of their birth. Like if
okay,
you were born in April, um, immediately after your birthday, you might want to like check to see where you stand as part of celebrating you as a person, knowing how your body is functioning. Because as human beings, we need to take care of our bodies for as long as um, we are here on Earth.
okay. Yes, that's true. That's true. Particularly, thank you very much for that answer. I particularly enjoy or I like tying that. I like how you mentioned maybe after your birthday, you just go for your health check. Tying it together. I feel like if something like that is done, it's easier to follow through because once your birthday is done, you know that okay, it's the culture, it's the norm for me that after my birthday, I go for my medical check. I feel like if individuals can try to tie that, that would actually work. Okay, so back to the topic: health screening and medical checkups, a luxury or a necessity. So,
I
what would
was
you what would you say to
I think it is a necessity because health is wealth. Um, Whatever you spend on yourself is not too much, because when you think about the consequences of not doing the needful when it comes to taking care of your well-being, then you realize the actual cost of not doing the regular screenings.
Thank you very much for that answer, ma'am. Thank you very much. I still have so many questions to ask, but sadly, time is fast spent. Any last words for our audience or any information on how they can reach you if they have questions
Uh,
linking
I would like to say
social
thank you
media?
so much to Agbari Multimedia for the efforts in encouraging healthy living and increasing awareness. What I would like to leave everyone with is prevention is always better than cure. And it is always good to know where you stand so that if there's anything that you can adjust in order to optimize your health, you do, versus a situation where you feel if it's not broken, it doesn't need to be fixed. We don't have to wait for it to break before we start routine maintenance in order to improve quality of life and and in order to improve quality of life and live healthy.
Okay, okay. Thank you very much for that. Thank you very much for gracing our invite.
And
And
thank
to
you
our
so much
audience,
for having me.
you're welcome. You're welcome. So, to our audience, thanks for staying tuned, and I hope you are able to glean some interesting insights on the advantages of health screening and medical checkups. You don't have to wait till you have it before you go to the hospital. Prevention is always better than cure. Remember that the cost of health checks is actually cheaper in the long run than when there's an emergency. So it's economical to make time for those screenings now than when the emergency comes up. So we've gotten to the end of the day's episodes. Don't forget to like, subscribe, and turn on post notifications so you get informed next time we post. See you again soon. Bye.